Hi, my name is Maria Rebozo Lapine, coming to you from our new Cafecito Time con Equality Health studio with my very special guest, Christian León, Vice President of Advanced Primary Care for Equality Health. Christian has more than 10 years working with practices in low-income communities, and I invited him today to talk about annual wellness visits. And why are they so important for our children, for us adults, and our senior community? Many of us don't schedule our once-a-year wellness visit, maybe because we don't know how important they are, or maybe we have barriers to access, or maybe it's just our busy schedules. In this segment, we are going to talk about some of the barriers and how we can overcome those barriers and why are these wellness visits so important. And while you're listening to this segment, make sure to subscribe to our new Equality Health YouTube channel so you'll know when our next Cafecito Time con Equality Health video is ready to be viewed. Christian, I want to welcome you to our Cafecito Time con Equality Health. I'm so happy to have you here today.
Thank you so much for having me, Maria. It's a pleasure to be here.
And Christian, I know that you're not a provider, you're not a doctor, but like I said, you have a lot of years working with medical practices and their patients. I wanted to talk to you today. I wanted you to share with us some information on wellness visits because I think that a lot of people are like me. I don't think about going to the doctor unless I'm sick. I don't think about taking my son to the doctor unless I'm sick. And I'm not the only one.
No, and it's totally true. I mean, I think the wellness check, the most important thing about the wellness checks is preventive. It's about preventive care. Preventive means to have a healthy person healthy.
That's exactly it. I think that I don't think we understand the purpose of it. And I know that these wellness visits is a great opportunity to sit with our doctor and talk and share things that have changed in our health. What else can you add to that?
No, most of the time you don't go to the doctor, especially because you're not sick. But that's not the reason why you're supposed to go to the doctor. I mean, the wellness checks, the main purpose is to make sure that you're healthy. And you mentioned something that is very important. For example, my kids, as soon as they don't need any vaccinations, I stopped taking my kids to the doctor. The only reason why I took my kids to the doctor is because they were playing sports and for the physicals. But then I remember receiving the calls from the primary care, when they were like 14 years old, 15 years old, like, Christian or Hector is due to the wellness check. Like, he needs any vaccines? No, then I'm good. Then I'm not going. And that's exactly not the purpose of the wellness checks. The wellness checks is to prevent, to make sure that they discover, if it's anything that is, bad, anything that can happen, to prevent that.
And I'm glad that you shared that about your children because the same thing happened with my son. I wouldn't take him. But in one of those visits, it was his primary doctor that realized that my son needed glasses. So you're right. It's about making sure that we stay healthy.
It's about, I'm going to give you a personal experience. Back in 2012, I went to the doctor. I don't remember the reason why I went to the doctor. But then they take all my vitals. And as soon as they start taking my vitals, they give me my blood pressure. And it was like 190 over 160. And I was thinking that maybe this is baseball, my average when I was playing in high school. But no, it was actually 190 over 160. And I said, that's normal. They said, oh, no, it's nothing normal with that. It's the first time that I actually took my blood pressure since I remember. Then guess how many years after I went to the doctor to control my blood pressure?
I have no idea.
It was 2012. I went on 2018. It took me 6 years to go to the doctor. And the reason why I went to the doctor, because I was having massive headaches. And my dad passed away from, heart, related problems. And my wife was, you have to go to the doctor. Sometimes, and sometimes this happens in our culture, it's just because we don't recognize that we have, a chronic condition. It doesn't mean that it's going to go away. We have to go to the doctor and make sure that actually if they can control, the chronic condition, and maybe if we actually went on time to see if they can cure the chronic condition.
Yeah, because I think that that's another purpose of our visits is that we make sure that they can find things early ahead so that they can be curable. You know, my family and a lot of my friends, one of the fears that we have, Christian, is that we're going to go to the doctor and they're going to find something.
Yeah, I mean, I think it's a quote in Spanish, right? That they say like, if you find, you will, I mean, if you search for something, you will find something, right?
Mm-hmm.
But in this case, it's not like the doctor wake up in the morning saying, oh, as soon as Maria came in, I'm gonna find something in Maria to give her medication. No, at the end of the day, the doctor wants to make sure that he's taking care of you. Then, if you have any conditions, go to the doctor. And this is another thing. If you're going right now to a primary care, I mean, we don't want to mention any names or anything, but if you don't receive a call every year telling you that you do for your wellness check, then you need to change providers.
And that's important because it's important to find a provider that we trust, someone who we've established that trusting relationship, because sometimes we have to share things that are kind of embarrassing, and I'd rather do it with someone that I trust.
But that's a problem, Maria, because if you don't go every year, you don't develop the trust.
That's exactly it. That's a very good point. Unless we go, unless we share our information with them, unless we have those conversations, they're not going to know everything that's going on with us. And in order for them to provide better care, they need to know us. You know, Christian, another barrier that I see a lot with our members and even our community is the barrier of transportation, not having transportation to go to the doctor.
Yeah, that's a big one right there. And most of the time, on Medicaid and Medicare, I mean, not most of the time. I mean, if you go to your card, in the back is going to be a telephone number. I mean, the benefits change depending on the individual, but just go, call the number, and they're going to make sure that you qualify either for emergency or for a primary care appointment. But just make a call. They have translation available. It's going to be super easy.
Yeah, and I think a lot of the times we forget to actually go and check our health insurance because they do offer a lot of things that we don't know that are available to us. So that's a really great tip that you gave us because they can help with transportation. I know for our members, our care coordination team is there to help them with transportation. Plus, these health plans also offer interpreter agencies as well. So another one that I wanted to cover because I think is becoming really popular is telehealth. It's having those visits over your phone, over your tablet, or your computer. Can we have these wellness visits through these forms of virtual visits?
Yes, for sure. Telemedicine is super important right now, for the technology. And the most important thing right now, Manny, I wanted to mention this. We're working right now to answer the question. Let's go back. Yes, Medicaid, Medicare, they cover for telemedicine services. Cash patients, self-pay is not expensive at all. I mean, they need to call it just to make sure how much is the price. But right now, we're developing a new pilot that we're going to be able, the provider is going to be able actually to be able to see the vitals through telemedicine. Wow. And this one is going to be super important because that way the provider can prescribe, medication with a peace of mind that he knows that he has all the vitals.
Christian, thank you so much for being here today. I know I have learned a lot. I hope that you found it useful. Thank you for joining us today, and please share this information with your friends and family. These once-a-year wellness visits, they're there to prevent illnesses and to find things before they happen. So make sure that you're scheduling your visit with your doctor. Make sure that you schedule it for your children, for yourself, and for your loved ones. Again, to make sure that they are in good health or to catch health problems in early stages. Thank you again for joining us today. Cheers to your healthy life.